is what's behind the data we're about to share, and that is the power of place that we have here in the Fox Valley and the power of partnerships as we have with our friends at ThetaCare. So just to give you a sense of the overview here, what we'll talk about, we're going to share with you our first destination survey, which we do every year. And I really want to thank Jamie Page Stadler and Chrissy Lambie and the entire career team at UWO for all the hard work they put into this. So this first set of data you're going to see represents the numbers from just under 1,500 graduates. And we have an amazing response rate on this survey, which is, again, a testament to the hard work of the team. So those of you who know surveys, know statistics, 91% is a great number to work with. And 83% of those students have a positive career outcome. They are engaged, they are on track, they are doing the work they love in the communities, in our jobs, in our local companies, or pursuing graduate study as well. And as we're going to see, the average salaries that those students are earning are also headed in the right trajectory. So if we dive in a little deeper on some of these data, this goes exactly to what Alex was talking about with the retain and gain. We in Oshkosh, we in Northeast Wisconsin are a net importer of talent to the state and to the region. That top number you represents the number of in-state students we have at Oshkosh who stay in the region, over 91% this year, which is a remarkable statistic. And just as important, the lower number you see there are our non-resident students, students who come to Wisconsin, come to Oshkosh to pursue study. And this year, again, over 40% of those students stay in the region. So when you combine those numbers together, we know that people are coming to study at Oshkosh, they're coming and getting their degree, but they are staying here. And the reason they're staying here, again, is the power of place, but the power of partnerships that we have here, like the one with ThetaCare. So going along just a little bit more, we're really proud of this number as well. And this is the number of students that represented in that survey who are not just employed upon graduation, but are actually walking across the stage with a job offer in hand, 82% over the last couple of years. And again, that doesn't happen just magically. They don't just wander into a job. It's a reflection of the networks that we've built, the partnerships that we have, getting students out early, exploring career paths, doing job shadowing, doing internships, doing clinical placements, like our friends with ThetaCare. And going a little bit more into numbers, let's talk about those salaries, because this is also good news. We know things are getting expensive. We know costs are going up, but our salaries are not just going up. They are keeping pace with the economy, and if you look here, with the CPI, with the cost of living here. So at or above the CPI, the cost of living, Consumer Price Index, over the last couple of years. So the overall story there, again, students finding their career path, succeeding on their career path, having a job upon graduation, and moving into a good paying job that allows them to engage with the community, pursue home buying, and maybe start thinking about raising a family right here in the region. So you can find more about that survey at our homepage at uwash.edu. We'll have some more data as well, but we encourage you to go and do a little deeper dive into the data. So we've long been happy to share our first destination report, but we're especially excited this year. Again, thanks to our career team for all their great work on this. The NACM, the National Alumni Career Mobility Survey. So this is not just a one-year snapshot. This is now a 5- and 10-year snapshot of longitudinal data. How are those students doing 5 years, 10 years down the road? And what we will see across the board here is that in every meaningful category, the students who responded to this survey and the prompts that you'll see here at the top, we are outperforming our peer institutions in the state and across the region, and outperforming national averages. So the students who responded, my institution helped me understand career opportunities, over 70% in both the 5, the 10-year, and the overall category, versus maybe closer to 60 across the peer institutions and national averages. So more than 10-point difference for UWO students in this survey. Going a little deeper, what about envisioning those career options? What are those options that I have in front of me? Did my institution help me explore those? Absolutely, we did. Again, about a 10-point gap between what we're seeing with peer institutions and national averages. Going on, what about that network? We know how important it is. And again, that doesn't just spontaneously appear right after graduation. That's something that we build over time. When ThetaCare and other employers come to our career fairs, talk with our students, work with our faculty, they're building those networks while they're still in school. And again, way above national averages, way above peer institution numbers in response to my institution helped me build that network. And then finally, we know this is absolutely important, having that internship experience, that high impact practice, going out and having an internship, having a clinical placement, getting out and actually doing that work to make sure it's a good fit, but also giving our employers that eye to maybe spot that talent for a student you do want to snatch up and have on your team come graduation, outperforming across the board peer institutions and US institutions. And so then finally, again, do we feel well prepared? They're getting out there, they're engaged, and yes, they are feeling well prepared. And again, that's a power of partnership right there. That's not just the students, that's not just the academic programs. That's that partnership that we have with the Theta Cares, with the other employers across the region to make sure we're getting the right students in the right workforce at the right time. So there's, and then finally that piece about salary too. Again, there we know how important that is. We know costs are expensive. So if we can put students out there doing the work that they love with partners who are passionate about what they do, earning a good salary, so that they have every incentive to stay here, to grow here as individuals, as professionals, and as families for Northeast Wisconsin. That's exciting. So again, there's more on the website. We encourage you to do a deeper dive, but we just wanted to say how grateful we are for partners like ThetaCare who make this all possible. We're proud of the work we do here at UWO. We're part of the integrated academic and career advising that we do, but that only happens because of the powerful place that we've got here in Oshkosh and Neenah and Appleton throughout the valley, and because of the great partners we've got with ThetaCare. So moving forward, we're not resting on our laurels. We need to grow. We need to invest. We need to expand these opportunities. And to do that, we're going to need more great partnerships like this, but we're also going to need great leaders. And that's who you're going to start hearing from now. So with that, I will turn it over to our still relatively new chancellor at UW Oshkosh, Dr. Manohar Singh.
Thank you. I don't have the slides and the colors that are so vibrant and beautiful out here. So thank you for going through the magic that we together create for the communities. Very proud of our university. I'm new. But the reason I'm here is because I knew what I'm stepping into, and that's a new chapter for us as a university and a new chapter for the community that we want to be part of. New chapter also in that sense that the world is changing so fast. And academic institutions are supposed to be the ones that lead that change, to shape that change, to become the change that we want our students to be, so that the world we serve becomes more fair, more equitable, more full of the dignity that humans deserve. Education, as I said earlier at many of my gatherings, is the surest and the shortest path. For your institution to accept our students as your employees, your family members, if you would, and then bring them onto the mission that you have, and that of accessible, affordable care. Food and health are the two basic human needs. And they both are so intertwined with the dignity with which human beings want to live. And that's what we as education institution and you as healthcare institution work hand in hand and offer some support for the families, for the community that we want to serve. Missions are aligned completely. We promise you that we want to work with you in partnership and serve your mission by providing the talent that is needed, and also learning from you as an institution as to what we want to be preparing our students with. The world is really changing in terms of the intelligence revolution, in terms of expansion of telehealth services, in terms of artificial intelligence, machine learning, helping us understand the data to much more meticulously designing solutions, much more customization of solutions, much more penetration into the rural areas and the remote areas that we want to. I would say this: everyone as an individual or as an institution has to be dynamic because the world changes. Universities are the place where the boundaries are expanded, whether it is science, whether it is healthcare, whether it is liberal arts, humanities, social sciences, cultural studies, you name it. The biggest thing that universities bring is openness of mind, learning, growth mentality, and that's what feeds the societies and the nations and the communities with the fuel that makes us the greatest. And you, as TerraCare, have really made us do our own jobs, our own missions in a manner in which we feel proud of ourselves. So thank you for that support of keeping us on our track, so glued to the ultimate service of community, human beings, and building a strong nation. My hat's off to that partnership. And I'm very optimistic that this is only going to go beyond as an exemplary role model for our nation. And I mean it when I say that, because look at my faculty colleagues, look at the people in this room, look at my students. We're all hungry for one thing, and that is how can we produce talent, human beings that will serve our communities and build our nation. So kudos to our partnership. I would pledge this to you all. Our doors are open for conversations, expanding our partnerships, learning from you, and supporting your mission. Any shape, form, sense, any place, please feel free to reach out. We will too, and we'll build it together. It's my pleasure now to invite Lynn Derman, President of the North Region of Freighter TerraCare Health. I just wanted to make sure I don't mess it up because I'm new here. But thank you for the opportunity to be here.
Well, thank you for being here and joining us as we highlight the important partnership between Theta Care and the University of Wisconsin-Oshkosh. It's encouraging to hear the strong statistics highlighting the UWO graduates working at Theta Care. They are numerous. I know so many, providing compassionate care for patients and families, as well as supporting caregivers in their roles. Northeast and central Wisconsin have a lot to offer in the way of high quality comprehensive healthcare, thanks to institutions such as UWO. And so, also, we are planning to invest in the future of our workforce. So, the space we're standing in right now is going to be the home of our graduate medical education program. And the goal, we call it the GME program, is to prepare physicians to care for tomorrow's health needs and challenges by creating advanced training opportunities for individuals who have completed medical school, including some residencies that are here for fellowship and internships and other specialty programs. And so our initial residencies plan will support growing primary care and specialty physicians needed in our communities. And so we really look forward to this space as we develop our simulation labs and additional classrooms, how we can partner together, because this won't be space just for physician training. It's where our nurses are going to train and our other clinicians are going to train, and we're going to have a very collaborative and community space. And so we're really looking forward to that. And so partnerships, we talked about our partnership, and we are just so thankful for the UWO partnership. And it's interesting, the Dean of Nursing has given us so much in recent years to think differently about our future nurses coming in, and how are we going to prepare our next our next generation for the workplace, but also what are they looking for in an employer. And so we really appreciate those insights, because it does make a difference in how we approach things. I will also say that UWO was the first to welcome us to the neighborhood when we announced that we were building a new hospital and medical office building in Oshkosh. And I think we look at that as not only our continued partnership, but also how can we partner together to continue to build on the great things that are going on in Oshkosh from an economic development standpoint. I was downtown Oshkosh this weekend, Saturday night. People were getting ready for the preseason Packers game, so it was a little light in it, but had dinner there with my family. And then, of course, you have to have some frozen custard when you're in Oshkosh. But, it's just, a lovely community. And I'm just so, so thankful that we're now a part of it in a different way. So the collaboration with the college helps provide future ThedaCare team members with the knowledge, skills, and development they need to continue our mission of improving the health and well-being of the communities we serve. It also resources our top talent. So thank you for that. And we are proud to support students in their education, which positively impacts patients throughout the region. And so sometimes we have students entering our workforce as patient care techs, and then they're going to school to become registered nurses or maybe other, clinicians. And we're just so thankful that we have that ability for them to, get real life experience while they do their education at the same time. Many of the graduates have already had, like I said, prior experience, whether it was through internships, training, or learning opportunities, and then they can jump right in as they start here on their very first day. And so we appreciate all of these partnerships, and we also want to thank our human resources team, including the recruiters and the talent acquisition team who work diligently to find the best people for our organization. So you don't know this, but every week I get an update of the December grads already. How many have signed, and who are we, who's on the list, and who's considering, and what can we do to bring that over the finish line? And so we're just really thankful for all of their work in that effort. And so many are here today, and so we want to thank them for that. And some are even UWO graduates, right? Of course, right? That's just, obvious. So here to talk more about ThedaCare's collaborative efforts with the University of Wisconsin-Oshkosh is Jenny Nikolai, and she is our Vice President of ThedaCare Medical Centers in Fond du Lac and Oshkosh.
Thank you, Lynn. I first want to thank UWO for the opportunity to be here with you today. Thank you for sharing that insightful data. You should truly be incredibly proud of the work you are doing. So thank you. Our commitment to the community extends the region from Neenah to Oshkosh and beyond to our rural communities. In the coming months, as Lynn mentioned, we're expecting the completion of our new health campus, ThedaCare Medical Center Oshkosh, located in the downtown area, complementing the area's major redevelopment and revitalization efforts. Since the groundbreaking, as you can imagine, a lot of work has been done. The exterior of the campus is nearly complete, and work on the interior is moving along nicely. Expected to be complete in 2025, the health campus was created to provide the best experience for patients and families by our dedicated care teams. Hiring is now taking place, with approximately 60 new jobs expected to be created for caregivers and staff at the campus. Speaking of hiring, in the Oshkosh from UWO filling essential healthcare positions, including some at our Oshkosh facility, as well as other positions at our various locations that support the delivery of care. These graduates are equipped with the essential skills needed to support the function of our local hospitals and clinics, helping to ensure the efficiency, effectiveness, and quality of local patient care. Our collaboration with UWO is indicative of the importance of an education industry partnership. Such partnerships help grow the classroom to workforce pipeline to better ensure an expanded number of healthcare professionals graduating each year. UWO graduates are prepared to join our workforce seamlessly and efficiently and continue to conduct themselves with professionalism and camaraderie. They eagerly and overwhelmingly have wholeheartedly joined our mission to improve the health and well-being of the communities we serve, empowering individuals to live their unique best life. As the population ages and healthcare needs increase, UWO graduates are becoming an essential part of providing the skilled workforce needed to meet those demands. Their technical skills and problem-solving abilities are crucial for developing innovative solutions to healthcare challenges, such as disease prevention, treatment development, and patient care. This effort is vital for our community's long-term success. The UWO ThedaCare Workforce Pipeline is a way to help grow our workforce right here in our region to keep students here and to let them know that we have careers for them right here. The partnership between ThedaCare and UW-Oshkosh is incredibly valuable, and we look forward to our continued collaboration. Thank you.
Thank you to our leaders for their remarks and for unveiling the data today. Thank you all for being here. For our media friends, we'll have a little bit of time afterward if you want to follow up with any of our leadership. We'll break out after we conclude. There's one data point that we didn't put in the deck that we really need to draw attention to today, and that is this: that in the class of 23-24, the data for which we're providing today, the top employer of all employers for UW-Oshkosh in terms of number of graduates hired that year was ThedaCare. And the number of graduates is 48, or as we like to say when we write it on paper, nearly 50. So that is remarkable, and they are nurses, yes, but they are also IT professionals and HR professionals, and you name it. So we are so grateful to have that dependence on Titan talent with a partner like ThedaCare. So thank you all for being here today. We'll hang around for a little bit, but please have a great day. Let's stay dry. Thank you all.